Welcome back to Wake Up Wenatchee Valley. I am Dan Kuntz. We make it a point every once in a while to check in with our friends at Columbia Valley Community Health, the great work that they do. We're here at the main campus on Orondo here in Wenatchee. And the gentleman to my immediate left took over from the retired David Olson at the start of the year. He is the interim Chief Executive Officer. He was the Chief Operating Officer for the last couple of years. He's been with this organization for 10 years. Manuel Navarro is joining us to introduce himself to, well, me for one. How are you?
Yeah, good morning, Dan. I'm doing well. Thanks for taking the time to come and visit us here at CVCH.
CVCH's profile has been sky high over the last 10 years, but you guys have been around for 50. This is your 50th anniversary this year.
Yeah, we're excited. As you mentioned, we've been in the community now for 50 years. Started off as a little van visiting fields for migrant workers in not only Chelan-Douglas County, but Grant and Okanagan as well. So you can imagine it was quite an endeavor driving that around, but have grown to where we are today and are looking forward to celebrating 50th year here in the community.
Nobody lasts for 50 years without knowing what they're doing. And of course, for Columbia Valley Community Health, the bedrock of the entire organization is that basic human health care is a right, is a human right, not a privilege. Everybody should have access to basic human health care when they need it.
Yeah, and I think the key word is access, right? And oftentimes people don't know how to take care of themselves or where they can go to find health care when they need it. And I think that's kind of the mission of community health centers across the United States, is really being able to provide affordable health care for individuals to take care of themselves and their family. And I say affordable because I think one of the biggest misnomers is that we're a free clinic. And that's not the case. Community health centers are not free clinics. We just do make it affordable. And even though healthcare is a right, I think people want to be able to pay for their needs, but make sure that they can afford it as opposed to having to sacrifice it because of other primary needs as well.
And there is a significant difference between Columbia Valley Community Health and the major healthcare provider, Confluence Health. Is a big difference between the two of you.
Yeah, I mean, we're all trying to improve the communities that we serve. I think, you know, our aspect as a community health center is we can't or don't turn anybody away for inability to pay. So we work with individuals. We offer sliding fee, again, to make it affordable health care. And our primary focus is on primary care and that preventative care. And you're really wrapping around patients, not just for medical, but behavioral health, dental, and other social services that we feel are important for someone's total health. So it's not just coming to see the doctor. You can come see a dentist or a therapist, or just talk to our staff to talk about insurance enrollment or other social services that you might need help with.
And your staff, my experience has been, your staff is top flight. Everything from the top down and across the board, everybody who works in this building and the satellite clinics in Chelan and East Wenatchee, they know what they're doing. They're good folks.
Yeah, absolutely. I think oftentimes I joke that people think of the community health center as the abandoned gas station at the edge of town that was donated to some civic-minded people who hired the retiring physician who should have retired 5 years ago. But that's not the case. You know, as you mentioned, all of our providers in every field of specialty are credentialed to the highest they can be. In fact, we require all of our providers to do that. It's not just a place where somebody can come retire or finish out their career. We've had, you know, we're lucky to continue to attract new providers and as we continue to grow. But I also think we're lucky that we retain a lot of our providers as well, which is always a challenge in community health center because it's hard work. You're working with people who need a lot of attention and a lot of energy and resources. And so we work with our care teams to offer that to our patients. And I think you see that in our retention, not only with our clinical teams, but our staff as well.
You mentioned the word challenges. I would be remiss if I didn't mention COVID. We're a little past 2 years into the pandemic. It looks like there's light at the end of the tunnel from the healthcare experts I've spoken to. COVID and Columbia Valley Community Health, where have you been over the last couple of years?
Yeah, we have been right in the thick of it with partnering with all of our community partners, the Chelan-Douglas Health District, Confluence, of course, playing a big role in that as well. And as you know, or many of our listeners know, we were early on one of the first areas that we could get testing. We were able to get vaccines earlier than most people because of our association with the federal government, and so we were able to offer that. And then, of course, really focusing on making sure that the disenfranchised individuals, people who are out in the rural areas, people who may not speak English primarily, or understand kind of a lot of the information that was coming at them, we really made an effort to go out and find those pockets of people to make sure that they had access to the testing, vaccination, and education that they needed as well. So although we weren't a large primary, in terms of volume, we couldn't certainly Confluence, but we felt like we really met our mission in getting the care and treatment to the right people.
And once the word got out, they understood the importance of it, because a lot of people poo-pooed it and no big deal and I'm never going to get it. Well, through the migrant community, it swept pretty early on. A significant number of hospitalizations and even fatalities. But once you got the word out to the non-English speaking community, they stepped up.
Yep, and that's part of our mission every year, right? Whether it's COVID or anything else, we feel like it's important for us to do a lot of outreach and getting information out to all of our community.
Well, let's talk about outreach. It's not just the Wenatchee campus that we're sitting on here at the on Orondo here in downtown Wenatchee. You got the East Wenatchee Clinic on 9th Street and Eastmont, which is going to expand here. We'll talk about that. You got the place up in Chelan. This is you have a large footprint and a lot of clients.
Yeah, like I mentioned, when we first started, we were serving 4 counties, Chelan, Douglas, Okanagan, and Grant. And as part of a community health center, you really designated a service area. And as the years passed and the needs grew, both Grant and Okanagan County ended up forming their own community health centers that serve those areas. So our focus now for the last couple of decades has been primarily Chelan, Douglas, and that's kind of, as you mentioned, Wenatchee, East Wenatchee, and Chelan being the major metropolitan areas that we have sites in.
What are you going to do for your 50th anniversary this year? You got big plans, or?
Yeah, I mean, plans always start with dreams, right? We do want to make it special. I think we feel that it's not just for us, but Columbia Valley Community Health is owned by the community. As a community health center, we're board driven. My boss as the interim CEO is a group of community members who live in the county, 50% of which have to be patients. So it's not just, the attorneys and bankers and other medical providers. Actual patients tell us what we do every day. And so as representative of the community, this celebration really is for everybody that lives in the Chelan-Douglas area.
Columbia Valley Community Health, as we mentioned before, celebrating their 50th anniversary this year, but really in the last 10 to 15 years, the growth has been tremendous in your organization. Tremendous, you've remodeled and expanded the campus here on Orondo. You're about ready to break ground on some new stuff on the east side. How can you account for the tremendous growth even over the last, say, decade of Columbia Valley Community Health? You went from an afterthought to a major player in healthcare.
Yeah, I mean, that's certainly driven by demand, right? The Chelan-Douglas County, the population continues to grow. And I think as more and more individuals realize the importance of taking care of themselves, they're seeking out primary care services. So we've just, as being board driven by community members, as they see the need in the community for increased services, we just try to respond as best we can. Whether it's expanding facilities here, we just finished our major expansion in Chelan, where we grew from one provider that has been there since 2001, working out of a rented space from the school district, to now a 17,000 square foot modern state-of-the-art facility with 6 medical providers and our residency program and dental and behavioral health. So in Chelan, that's been a major growth. What we're focusing on now is meeting the demands that we're seeing in the East Wenatchee population growth. A couple of years ago, our board had the foresight to know that East Wenatchee was going to need improved access to primary care. We bought those 5 acres on the corner of Eastmont and 9th Avenue in East Wenatchee, built a smaller clinic, just kind of excursion into primary care there. but now see that we're not meeting the demands there. So we're anticipating future growth. So we are in the final development stages of a new clinic in East Wenatchee that will house 10 medical providers, 2 dentists, hygienists, behavioral health. We're also adding 24 new therapists for the community as well.
So this campus has been expanded, enlarged, and remodeled. You're about ready to break ground on a new building in East Wenatchee. Obviously, my viewers are going to say, where does the money come from? How do you make ends meet if you, from a budgetary standpoint, Columbia Valley Community Health? Where does the dough come from?
Well, you know, as I mentioned, we're not a free clinic, so we do charge for our services. And I think another misnomer that a couple of things that people think of is that, you know, if you have insurance, you can't come to us. We take insurance just like any other provider. So a lot of our revenue is actually driven by the services that we provide from people who are insured or people who pay self-pay. And even those individuals who don't have insurance, as I mentioned, we charge them a nominal fee that is affordable for them. And so we do have revenue coming in from the services we provide. Now, one of the things that people also think of is that we're 100% funded by the federal government, and that's not the case. Basically, about 18 to 19% of our operating revenue is that base grant that we get each and every year from the federal government. But the intent of that is really just to cover the uncompensated or reduced uncompensated services that we do provide. And even though there's an Affordable Care Act, we still have about 13% of our population is uninsured. So the services we provide them really gobble up those funds that we get. Otherwise, it really is about us being a fiscally responsible and sustainable business and being able to reinvest in ourselves, and again, then for the community as well. Not for profit, no one's walking away with a big paycheck or a big end of the year stock out option or bonus. It really, everything that we make comes back to the organization, and then we give it back to the community.
Where do you see the challenges or the goals, if you will? I like goals, it's a better word. In 5 years for Columbia Valley Community Health, where do you see this organization in 2027?
As I'm meeting the demand, even though we have plans for continued growth, we know that we're not going to be able to meet that. Even today, we have challenges with getting new patients in, getting existing patients back in to see the providers they want to see. And this is across all of our service lines, medical, dental, and behavioral health. In particular, though, it's going to be the behavioral health that's the biggest challenge. I think certainly coming out of COVID, we're starting to see a lot of the behavioral health aspects of how that's affected our community. But even before COVID, we knew that was going to be a area of demand and growth. And we just start working hard to recruit and find new therapists to come to this community and offer those services for our patients.
Why do you do this? What is it about when you were a kid? Said, I want to get into the healthcare field and I want to help people be healthy. I want to get in administration and understand the nooks and crannies and the headaches that come with it. Why do you do this? What drives you to do this job?
Well, I think what drives anybody to go into the healthcare field is that we want to fix things. We want to help people. And certainly I could have gone and worked in a private healthcare setting or anywhere else. But I do this, what drives me to come to work every day are the patients. It's seeing that, that socially disadvantaged, whether it's economically or culturally disenfranchised father who's bringing in their 2 children to get vaccinations because he wants his children to have a healthy life. And we offer an opportunity for him to come and do that in a comfortable, affordable setting where he's not feeling like he is disenfranchised and scared to come. So I do that because of the patients we serve every day.
I'm assuming as we close this out, our talk with Manuel Navarro, who's the interim CEO of Columbia Valley Community Health. I'm guessing you have more good days than bad then, for the most part?
Every day is a good day. I love what I do. Now, work is work, right? Otherwise, we wouldn't get paid for it. But I'm sure you love what you do. I love what I do every day. And it makes it a lot easier when you're coming to work for an organization that you truly believe in and is doing the right things. and allows me as a healthcare administrator to succeed every day.
Manuel, I'm glad you took some time off from your busy day to visit with us. Big fan of David Olson. I know you got some major shoes to fill, but word that I've gotten so far is that you're doing a bang-up job, and maybe come June, when the hiring of a permanent CEO of Columbia Valley Community Health, your name is right at the top of the list. That's my hope anyway.
Well, thank you. I hope so too. But we'll make sure the board makes a good decision, and regardless, CVCH will continue to be here for the community.
Again, thank you for spending time, and happy 50th anniversary.
Thank you very much.
To the organization, not to Manuel and his wife. They haven't been married that long.
No.
You're watching Wake Up Wenatchee Valley. We'll be right back.